Hi folks, I'm Dr. Ed Beyer. Today we're discussing one of the 22 ways that are in the scientific literature that our thyroid function can shut down. 22 different reasons for hypothyroidism. Traditional medicine checks for one of them. And this is a very common one that I see. Poor conversion of the inactive form of the thyroid, T4, over to the active T3 due to cytokine surges. Cytokines are chemicals of inflammation. So when somebody is systemically inflamed, they get extra amounts of cytokines, and cytokines depletes the ability of converting T4 inactive over to T3 active. Now remember, what comes out of our thyroid gland when TSH stimulates it is the inactive form. Over 90% of it's inactive, it's T4. And this needs to get converted over to T3 via a certain enzyme, and that enzyme won't work very well if we have cytokine surges or inflammation. The irony is most doctors don't even check for T3. They give you Synthroid, they give you levothyroxine, which is actually T4, and they're assuming it gets converted over to T3. And that assumption is a very big leap of faith, because I'm telling you, on the lab work that we do, we run 9 markers on our initial thyroid panel. Many people are not converting their T4 over to T3 due to systemic inflammation. So the causes of systemic inflammation, well, the standard American diet in and of itself is super inflammatory. Food sensitivities is a very, very common thing. So we checked for these in all of our thyroid patients. Hidden infections, especially in the gut. Leaky gut syndrome, where the barrier between the inside of our body and the outside of our body in the gut is leaky, and now large molecules and toxins are getting their way into the bloodstream, causing systemic inflammation. Autoimmune disease, and the most common of the 22 ways of low thyroid is Hashimoto's, which is an autoimmune disease. That causes inflammation. So remember, the typical thyroid patient that comes to see me, they have like 4 or 5 of these 22 different ways all at the same time. So until we really identify through proper lab testing and eliminate these reasons, they're never going to get healthy. So the devil's in the details. We really need to find out all the different reasons. And functional medicine is traditional medicine is woefully inept when it comes to that. Poor normal gut flora, when we get an imbalance of gut flora, too many bad guys, not enough good bacteria in the gut, will also cause systemic inflammation. So inflammation really is the common thread in all chronic illness. It's the thing that really, really destroys our body, but it has huge impacts on our ability to convert the inactive T4 over to T3. I'm Dr. Ed Beyer. Hope that helps. Have a great day.